special populations are at high risk of homelessness?
Yeah. Well, I think, I think we typically go to equity-seeking groups or racialized groups like people with mental health issues, people in poverty, people from different cultural groups, women, children and youth, people with disabilities. Those are groups that we tend to go to. But honestly, I think the root cause, the underlying vein that is common across all groups is people who have experienced high rates of trauma and have limited access to social supports and healthy relationships. So for me, we can't say substance use or mental illness causes homelessness, because there are lots and lots of people who struggle with those issues who will never be homeless. What we can say is they're risk factors. And so if you have a lot of risk factors like poverty and substance use and mental health issues that go unresolved, you're at high risk for homelessness. But really the only causes of homelessness are, a lack of affordable housing, and in many cases, a lack of social supports, or people who will support you and can support you when you're in a time of crisis.
And sort of in conjunction with that, where do seniors fall in this as far as a risk group?
Yeah, I mean, I think they are a high risk group. And I think because seniors are on a fixed income, and, we do have federal benefit programs for seniors. And we do have some housing programs for seniors, but they are a high risk group, of course, because there are limitations in the resources that they can access to get themselves out on their own, right? So if you're 65 years old and experiencing homelessness, the chances of you getting supports to find employment, for example, would be less likely than someone who may be younger. So yeah, seniors are definitely a high risk group. But again, it really comes down to who do they have in their social network? Who do they have in their community networks? And which services are they accessing? Because all of those things, I think, can reduce the risk.
For sure.